So while we're waiting for the people to join, welcome everyone for the second day of the Technion Summer School of Computer Security. And this year our special topic is about privacy. And today is dedicated to something that you may have heard of, which is contact tracing. So without further ado, I'm going to start with a very quick introduction for all the things that we're going to discuss today, which is contact tracing. And I would like to thank Eyal Ronen and Benny Pincus for giving me the basics of their slides so I can use them. So as you probably noticed, we're not currently at the Technion because of this small thing called COVID-19, and there is an international pandemic running around. And you probably are aware of it. If not, I greatly urge you to wear masks and just social distance yourself until you hear what COVID-19 is. However, in the meantime, for the rest of us, we would like to have two things going on in parallel. First of all, not being in lockdown, and second of all, still maintaining our health. So besides the personal protections that we can still take, the question is, can we fight the disease? Now, the thing is, COVID-19, one of the most interesting aspects of it, or most disturbing aspects if you're a regular person, not an epidemiologic researcher, is the fact that you can be infectious to other people without showing symptoms, which means, and using the DT3T slides, you may be infected, then you become you infect other people, contagious, while not being aware of it. So you infect other people, and then only then you feel sick. But in the meantime, the people that you have infected may infect others. So actually, we have a chain of infections where a single patient infects other patients who are then going and infect other people. So the main idea behind contact tracing is to identify the people that you may have infected, isolate them, so they will not infect other people. So if by chance they get sick, they are not transferring they're not infecting other people as well. So this is the main idea. And the reason this is going to help us a lot is because at some point of time, we will succeed to reduce the number of new infected people, which will help the health system and everything to cope with the current number of infections, and the hope is to reduce, and some of you might have heard the R0 constant, which is the rate in which the exponential growth of the pandemic goes, to go down to as little as possible. So this is what we're trying to do, and you can think of several practices to do that. So if, for example, this is indeed somebody who gets infected, then he infects other people, exponential growth, and we're trying to identify him so he will not infect other people. So the simplest solution would be to do it in a manual manner, meaning once you are identified as an infected person, you go into your health provider and they start asking you questions. Where have you been? Who did you have contact with? So when you think of that, if I ask you now, where have you been in the last 14 days, which is the window of infection for COVID-19, I think most of you, unless you have very good memory, or by chance you're currently in a lockdown or self-isolating, it will be very hard for you to tell, oh, I was at 9:38 in this bus, on this bus, and at 5:22 I was there, and so it's very hard to remember the exact locations at times. Another problem, which is currently exposure is defined to be, or most of infections happen if you happen to be below, under 2 meters for more than 15 minutes. Meaning you might remember who was there and when, but it's a bit unclear whether he was there or whether he was wearing a mask. So this is something that requires a lot of memory from your side and a lot of very delicate questions. And one thing to remember is that sometimes the contacts are unknown. If you take the bus, you don't necessarily know all the people on the bus. And I would like to urge you to use Vanessa's results from yesterday to de-anonymize all the other people with you on the bus, because their traffic records are going to be made public. But while this is happening, you still might not know all the people. Think of a professor entering a classroom. If you have 400 students or more, you're not expected to remember everybody's names. And depending on the universities, and some of them, even if there are only 4, you're not required to remember all their names. So you may not know the people, and therefore they cannot be contacted. Because the second problem is that after you identify these people, you have to contact them and ask them to be isolated. Now, here's the problem. If there are many infections and you don't have a good process of identifying who was in contact with whom, you're going to get into the problem of many new false positives. Like if, for example, we discussed the Israeli train on Sunday morning, where everybody are trying to squeeze into the train, or if you want a slightly more international flavor of that, Tokyo in the morning in the rush hour. Some people might get this false alarm and they will be asked to isolate themselves. So we have this problem of too many false positives will make the entire point of contact tracing moot, because at the end, everybody will get into isolation. And the second problem is that we have to work with very inaccurate information, also from the other's point of view. For example, at the beginning in Israel, we had the manual contact tracing, and you got lists of, in this location, there were some COVID-19 infected person, and then you had to remember where you have been at that time and day. So it's a bit more complicated as well. So let's automate. I mean, instead of doing it in a very labor-intensive manner, and instead of doing this, let's do it automatically. So everybody have their cell phones with them, right? So you have these locationing services. Most of us have them on. So you can take the GPS signals, the Wi-Fi signals, or any other location information, assisted GPS, or whatever you want. And you can identify where people are at the moment. And then you collect all the data and process all the data. And now you have two databases. The first one is who was at what time where. And the second database is who should go into isolation. So each time a new patient comes or is identified, we go to the first database, we process the data, we look for all the people who were in his vicinity for the required exposure time, and then we ask this person to isolate so the pandemic will not propagate. And that's it. Everybody are happy. Now, as you probably know by now, if you're joining us, this is a summer school on privacy, and obviously there is a lot of private and very delicate information with your location information. I'm not talking about the very famous case from Argentina where a wife who had an affair was detected by the fact that she infected her lover. And I'm not talking about other things, but just by the fact that people know where you are, I think it contains quite a lot of personal information. So the question is, how do we do it in a privacy-preserving manner? So ideally, we would like to have this trusted third party where we send all the information to him. In our case, Moses from Hayudim Baim, an Israeli television show, and you just tell him, I met X at time Y. I don't need, and this is a very important thing about contact tracing. Contact tracing doesn't need to know where have you been, but who was in contact with you. So ideally, every person will tell this trusted third party who did they meet at what time. Then this trusted third party will know all the contacts, but not the locations, because the locations are completely irrelevant. And it will collect all the data, and when somebody identifies himself as sick or is identified, then this entity will just do internal processing and then contact all the other people who were in contact with this person, telling them you should self-isolate. Now, I'm not talking about the importance of privacy in social graphs. Social graphs are very delicate. They can tell a lot about you, and of course, location data is also very delicate. And there are going to be, as we see today, several issues with the fact that some parts of the social graph are anyway going to be revealed because we see these people are going to be self-isolating. So ideally, we have this one entity that we all trust. The problem is that do we actually trust this single entity to maintain two databases? So the simplest solution, which is the centralized solution, is everybody sends their information from time to time or all the time to a server, and the server indeed knows all the collects all contact information all the time. And if you want to increase security and privacy very easily, you just have one server that knows all the contacts, and it outputs to the other server only the list of contacts for the infected people. So you break the functionality into two. So let's assume this is one centralized solution. The second option is actually something which is decentralized. And the idea there is to allow people to learn that they were exposed without telling them to a third party, usually the government or a company, and we trust the users to isolate. So the user gets a notification telling him you were exposed and he's supposed to isolate. So roughly speaking, these are the two questions we're going to see today in the different talks. There are two main questions. First of all, who controls the data? There's going to be a lot of data. Either it is stored in a centralized location by the government. Again, I'm using government as a central location, but it may be a company, or the users who control the data locally, and also who gets the output, whether it goes directly into the government or the users get it. And the trust and privacy behaves very differently according to this simple decision, whether it's centralized or not. In a centralized manner, you need to trust the government not to misuse its power. And in a decentralized solution, you need to trust the users to do the right thing. And I'm not going to discuss the social impact of doing the right thing and how complicated it is. So